When treating the cervical region, it is crucial to consider the air-filled tissue underlying the lung. The pressure waves 2 to 4 centimeters maximum penetration should remain outside of the lung. The application may generally cover the region or a specific anatomical structure like shown previously with the lumbar application. The energy delivery may be adjusted during the treatment to deliver the required energy levels. It is possible to change the handpiece holding position and also possible to use the free hand to increase the stretching of tissues or to improve the contact with the applicator. Finish watching the video for a full demonstration of the treatment.